Hey guys, welcome back to my channel. Today I am filming my breast reduction vlog. It's going to be a before and after. I am going to try to cover all the information I think is important in this video. If I leave anything out, I'll probably make a part two. But I've broken it up into different topics kind of, and I'm going to get into every topic a little bit and sort of go over why I'm doing it, what's going on, the history behind it and things like that. So it is going to be a before and after video. I will have different outfits and things like that from now until then. My surgery is in about 3 days at this point, and so I want to make sure that I filmed this part of the video. I might be looking down here and there because I wrote down some notes. So anyways, if you're new here, I'm Tallene. I'm a lifestyle vlogger, and yeah, I'm about to have a breast reduction. Okay, let's go over the first topic, which is my stats. I am 5'7". I weigh 175 pounds. I fluctuate between 175 and 180. And I am 44 years old, and my breast size currently is a 38J. Okay, next topic, let's talk about my why I'm getting breast reduction and sort of the history of my breast growth and things like that. I'm getting a breast reduction because I am miserable. I mean, you could probably tell. My breasts are huge and heavy, and they hurt my shoulders, my neck, my back. I walk around every day trying to just do daily tasks, go to work, go work out, stuff like that. And it looks like, you know, I'm normal just because I'm doing everyday stuff that I have to do, but I am actually miserable the entire time. I'm always in pain. I always have like chafing going on. I have to put like Neosporin on my shoulders. I have to use a chafing stick everywhere. It's just, I don't know, just pain everywhere. I'm completely uncomfortable and miserable at this point. So, and I'm a person that fluctuates in weight a lot. I know some people keep their weight throughout their life and their just body's good about that. My body is a fluctuating body. Sometimes I'm skinny, sometimes I'm a little overweight, sometimes I'm in the middle. My weight has been, 128 to 178. I don't know. It's just, I'm just a person that fluctuates in weight. So with that comes my breast size fluctuating. So anywhere from a D, double D, triple D, E, F, H, and now we're at a J. So just uncontrollable and uncomfortable. The history behind it is that my breast grew when I was about maybe 14, 15 years old. They kind of grew overnight, like over summer. And before that I was like completely flat, but I remember going into, I think it was like freshman year, I went into high school, and I remember everyone thinking I had a boob job, because that's how crazy it was. But of course I did not have a boob job at that age, but yeah, that's kind of what happened at that time. So I had been wanting a breast reduction, maybe I would say a couple years after that. I think it was in my 20s when I went to my first doctor to check and see if I could get a reduction because my back was hurting, I remember at that time. And he said, yeah, I could do it for you, but I don't really want to because, what if you get older and you want kids and they're going to grow back and stuff. So he kind of talked me out of it, and I didn't do it at that time. I did go to a couple more doctors after that. I just didn't feel comfortable with any of them, and I kind of went on with my life. At this point, I am just to the point of no return. I want to get it done, and I have gone through every step to get it done finally. So that is my why, and that is the history behind it. Okay, next let's go over my lifestyle. So I am a bartender. I am on my feet probably, I don't know, like 10 hours a day. I work at the airport, so it's very busy. Not much time to sit down. I do sit down maybe for like 30 to 45 minutes for my break. But other than that, I am walking and moving and just on my feet all day. Very active in that environment. And then besides that, I do work out probably about 3 times a week. I would say I have a personal trainer. I've had trainers and coaches for years, and that's just kind of how I like to live my life. I'm not someone that like pushes myself in the workout area. So I need someone to push me, and I love having good coaches. So I have a coach that is a strength and conditioning coach, and he's also my boxing coach. So that's sort of my lifestyle. Other than that, I am an introvert and an extrovert. So I am social as well. Every week I do go out with friends and family and things like that. So I have a, sort of an active lifestyle, and I also have my at-home introverted lifestyle. So I felt like I should kind of go over that. I think it kind of helps to understand, each person's journey. So there's that topic. Okay, guys, next let's talk about the emotional part of this journey. I think everyone has a little emotions going into this. You're used to your body being a certain kind of way. Whether you like it or not, you're just kind of used to it. So I am having those moments where I'm just kind of like, oh my God, I'm used to having my boobs there. I did talk to my doctor about it too. I was like, I've had these since I was, 15 years old, and I'm used to them, touching my arms. Like I'm just used to having them there as much as, I want to fix them. I am used to having them there. So we did talk about that. That was a discussion. And we did talk about in my pre-op the size that I'm going to go down to. And right now we actually don't know. He won't know until he's, in the middle of the surgery, just because we could have some complications with the size of my breasts. And, originally I asked for a C cup, but he told me that he could not take me down to a C cup because I could possibly lose a nipple. Nobody's trying to do that. So he said that he could take me down to a D, and I said, okay, great. Just, anything's better than this. But then when we talked the last time, actually, he said that, if I get in there and it's between a C or a double D, what do you want? And in that moment, I just couldn't think. I was like, you know what? I don't know. I'm used to having my boobs, so I don't know right now. And he said, it's okay. You don't have to decide now. Just tell me the day of. And the minute he walked out the door, I was like, C cup, of course. Why would I even double think about that? Like, I'm going through all of this, of course, C cup. But anyways, so I have gone still back and forth with that, the sizes, but I think right now I am still wanting, a C or D cup. But in the end, I just told him, do your best, do whatever you can do. Okay, let's go over how I picked my doctor. Some of my family works in the medical field. I do not obviously work in the medical field. I'm a bartender, but some of them work in the medical field, and I always kind of ask them, who their favorite doctor is or who is a good doctor and that they've heard of and things like that. Since they're in the mix, one of my cousins actually recommended this doctor because she has worked with him. So he came very, very highly recommended. And then I did do some research online. I started following him on Instagram and things like that. And I really liked what I saw. And then I made an appointment. I think they charged me like $100 to make the appointment, and then it goes towards your, procedure if you get a procedure. It was something like that. And I went in and met him, and we just clicked, and he was super nice, super informative, made me feel really comfortable. So that is how I picked my doctor. You can obviously go to several different doctors if you want to. You can get second, third opinions if you want to. Like I mentioned, I've been to other doctors before throughout the years. So I felt really comfortable when I met him, and so I still do. All right, next, let's go over the payment. So I have watched so many breast reduction vlogs at this point just to get comfortable with what's about to happen. And, again, everybody's journey has been different. Everybody's payment has been different. So some people have had everything covered. They've even had a nurse come to their house and that was covered. I think that was in Canada, but I've watched vlogs from everywhere and everybody's situation is different. I can only speak on my situation personally. So I have a medical insurance company that does not cover any sort of outside work. So my plastic surgeon actually takes insurance, but not the insurance that I have through my job. So I would have to go through my insurance company. I actually do not want to do that. I trust my doctor, so I'm going with my doctor. And I could get another insurance company on my own and go through that process of getting it covered in that way, or some of it covered. I don't think they cover all of it, but that would take another 3 months or so and a lot of back and forth. I deal with medical issues a lot already because I am asthmatic. So I have a lot of issues with insurances and things like that and going back and forth. So I kind of already know the deal of how things work, and maybe for some people things move smoothly, but for some reason for me, things never move smoothly. Even this week, dealing with my insurance, things have not moved smoothly, and I've had to call and complain and yell at several people. So, but I don't want to get into that because I want to stay positive in this video, but just to let you know why I'm not waiting the 3 months. For one, I'm completely miserable. Like as I'm sitting here talking to you, my shoulder's burning. So I'm completely miserable. I can't go another day. And like I said, my job is so active. It's very hard to be miserable and be active and work in customer service and do all that for 10 hours a day, 5 days a week. So that is, you know, part of it's my misery. And the other part of it is I can't deal with another medical issue. Like going back and forth through doctors, I just can't. So I have chosen to just go through with it and pay for it myself. So that is what I'm doing. I don't have, you know, money sitting around to pay for it, but I have financed it. So my doctor's office lets you finance it, which you can talk to your doctor's office about that and all these different details. Again, everyone's going to be different, but personally, they finance it. And so they try to help you out in that way. I use CareCredit. Some of you guys might have heard of that. It is a card and it's used for medical situations, dental, medical. You can use it for anything like that. Recently, I went on their website and I upped my limit. Didn't know if it was going to work, but they just said, you know, how much do you make and how much do you want to increase your limit? And I put like 10,000. And I want to increase it. I forget what it was at, but I increased it to 10,000. And I was like, oh, let's just see. And it took like 2 or 3 seconds, and literally it was like, okay, you're approved. I'm like, what? Anyways, that's what happened. So you can do stuff like that. You can use CareCredit, you can finance, or just talk to your doctor's office. My whole procedure is costing me 16,000 something. It's about 17,000 for the entire procedure with the anesthesiologist and everything like that. So I put, you know, some of it on the CareCredit and then some of it on a different card. So whatever you got to do to get it done, just get it done. I'm that kind of person. Just to give you guys an idea, when I want to get something done, I just get it done. I just go for it and do it any way that I can. So again, the misery has pushed me to this point, but I don't care. So that's the payment part of it for me. Yeah, I watched so many vlogs. Some people got the whole thing covered. Some people got part of it covered. And some people are like me where they had to just pay the whole thing. I want to mention that I am going on disability. So my doctor will be putting me on disability for this procedure. So I will be getting some sort of funding from there. Obviously it's not going to cover this, but something is better than nothing, right? And I'm not getting any money from work, just whatever I made so far. That's, yeah. If you have sick time and stuff like that, you could use it, but I've used up all my sick time, so. Anyways, that's sort of, if you guys want more details on that, you can, leave a comment and I will get into stuff like that. But that is the payment part of it for me personally. I also want to mention that I was actually about to quit my job just to get this procedure done. That's how, uncomfortable I am, because I didn't realize that we could actually take a leave of absence for, our medical procedures. But it's a good idea to talk to your job. We can actually take up to 3 months off. It's, again, not paid, but you get to keep your job and you get to go on leave. You just obviously have to do a bunch of paperwork with your job and with your doctor and things like that. So I did want to mention that in case anyone's, having difficulty. Ask your job and see if they will give you a medical leave. All right, next topic is things that I've had to do prior to getting my procedure. My doctor's office gave me a packet and I just kind of had to go through the packet. I had to take it to my doctor. I had to get a physical and I had to get, he really only asked for like 2 things of blood work. One of them was a CBC, the other one was a Chem7 panel, and then he also asked for a mammogram. So every doctor is going to be different. Your packet might be different. And actually, I also have to take a COVID test like 3 days prior. So it's just a couple things like that. And I did already get everything done. The mammo had some complications and I had to go back for an ultrasound, and it was, eventually cleared. But you do have to do these things and make sure everything's okay and cleared. Those are the things that I had to do. I can't really think of anything else that I had to do prior. Just basically the payment part, the blood work, the mammo. Yeah, that's what I've done so far. And then your pre-op, obviously going in and talking to your doctor a week or so prior. And then the packet pretty much tells me everything else that I need to do. So yeah, the packet will tell you like you can't have ibuprofen or certain medications 2 weeks prior. Can't have alcohol 24 hours prior. If you're a smoker, you're gonna have to stop smoking, stuff like that. So read your packets, make sure you're following it. That's what I had to do prior to my surgery so far. Okay guys, now I'm gonna go over a procedure I did prior to this complete breast reduction that I'm about to do. I've met my doctor before, obviously. I actually met him 2 years prior. And I went in for a breast reduction and then we sort of discussed it, and that turned into me actually only getting lipo, and I'll go over that in a second. I need a coffee break. Okay, so I went in 2 years ago, and what happened was I explained to him that I actually wouldn't get a reduction if I didn't have the issue of my left breast being bigger than my right breast, which I should have mentioned in the beginning of the video, but I forgot. So my left breast is bigger than my right. And I know a lot of people say, oh, everybody's one breast is bigger, one foot is bigger, one hand is bigger, whatever. But this is totally different because it's not like a slight difference. It is a major difference. This breast, I feel like is like 3 times bigger than this one. So you can't tell when I angle it in pictures and videos and stuff like that because I'm used to it. And if you're not looking for it, you're not going to see it. But obviously I feel it and see it and have to deal with it every day. So this breast is a 38J breast. This is not a 38J, but because of this one, I have to get a 38J bra. You'll see when I do the before and after part of this video how much bigger my left breast is than my right breast. It's just out of control. And it's lower because it's heavier. So anyways, that is what we talked about when I first went in, and he said, okay, well, we could do something unconventional. If you want, I could try to lipo the left breast and we can see how that goes. And he said, I can do a procedure where it's some sort of heating procedure, and it will lift your breasts a little bit. I have to be very careful to not, burn you on the inside and things like that. I'm not in the medical field. I don't really know the details of this procedure. I'm not a doctor, but this was a discussion that we had and I thought about it. The recovery time, much shorter. Scar is just one hole that, he goes through for the lipo, and no scars. So that sounded pretty awesome to me. And at the time I lived in a studio apartment, so I didn't really have anyone that could, help me out afterwards if it was going to be a full breast reduction anyway. So I kind of thought about it and I said, okay. So we went through with the lipo and it worked out really well. The lift worked out really well. I did have pain after, but I just took my medicine for it. I like to take it like an 800 ibuprofen for my pain, but he did give me a couple different, options. And yeah, I think it hurt pretty bad for like a month after, but I got through it and it worked out pretty well. But what ended up happening is my breasts are really dense. They're not a lot of fat. They're actually breast tissue, I guess. So he could only take out like half a pound at that time. And after that, I gained weight. I think in those 2 years, I gained about maybe 15, 20 pounds. And then my breasts just grew again and more. So that is an option. I don't know that it's an option for everyone, but it was for me at the time. I don't regret it. It was, an experience, and now I'm more comfortable with getting the second procedure just because I've been through, something like that already. So I don't regret it, but I did want to bring up that I have had lipo in my left breast, and now I'm going in for a full breast reduction. All right, going off the topic of my last procedure, my nurse was really awesome. And my anesthesiologist was really awesome. My doctor was really awesome. Again, I felt really comfortable and happy with everything. It's something that I had never done before, had never experienced before. So I just kind of want to bring up things that people don't tell you in situations like this. After I got out of my procedure, actually, my procedure was supposed to take an hour and ended up taking 2 hours because of the complications of my breast being so large and dense and that sort of thing. But yeah, when I got out, my nurse was really nice. I was coming out of the anesthesia and I actually started crying. So I think that happens to some people. And I don't know why I cried, but I asked her if it was normal and she said yeah. And then everything was fine afterwards. I feel like they gave me, I don't know if they gave me juice and crackers or something, or maybe I'm imagining that or dreaming that. I don't know. Anyway, I woke up and my nurse had to dress me. She's so sweet. And they actually have to take you to the bathroom and stay in there and make sure you pee. So these are just things that you don't realize until it's happening. And I just kind of want to mention it to you guys so you're not surprised after a procedure. I'm sure everyone's different, but this is what happened in my case. And it was fine. I did end up going to the bathroom and everything was cool after that. So again, I am now, comfortable to have a procedure done again because I've been through it already. Okay, now I want to go over some of the prep I have done. You never know what you're going to need after the fact. Once I come back from my surgery and I'm home is when I'm going to know how I feel and what I need. But from watching everyone else's vlogs, and thank you everyone who's vlogged breast reduction surgeries, I've kind of gotten a couple things that I thought would be good for prep. And a lot of people mentioned getting these zip up bras from Amazon. So that's what I did. It came like 3 in a pack. I have another one, like a black one. So there's a bunch of different colors you could get and different companies that sell them. But yeah, I got those. I'll try to put stuff in the drop down menu, like everything I got. So I got those bras because, you're gonna have to take your bandages off and have something to put on. For some of you that know what your size is going to be, it might be easier. Again, I don't know what my size is going to be. My doctor doesn't know yet. We'll find out when I wake up. Surprise. No. But I did think I got an extra large. And yeah, I did. I got an extra large because, you know, to me, I just know my boobs are always going to be big. So this should cover me even if I'm a D cup or double D cup or whatever. Then I got this lanyard. Super cool. It is in case, oh, I should bring this up. I might not have drains. I may or may not. My doctor actually likes to not do drains if he can, if possible. So he will be trying to not do drains on me. And to me, that is amazing because just the idea of drains, I don't know. I was getting kind of like anxiety from it. So I hope that I don't have drains, but if I do, then this lanyard is going to come in helpful because you hook your drains onto this when you're taking a shower. And he actually told me I could take a shower the next day. So obviously you're not gonna like scrub and stuff like that, but he did say I could shower the next day and I love to shower. So I'm excited that he said that. Okay, let's get into the next item that I got. They had told me that once you have your surgery and you are laying down, obviously you're gonna be laying on your back. They don't want you getting out of bed using your arms. So they had told me that I will need to use my abs. And I'm like, what abs? But anyway, yeah, you're gonna have to use your abs to get out of bed. They do not want you pushing with your arms. So I decided to buy myself a little pillow that, it's actually a big pillow. It's called Yogi Boo. I'll try to put it in the drop down too. And I'm gonna show you guys right now. It is so cute and comfortable. It comes in all different colors. I think it was $100 or so. I don't remember, but I'm so excited about it. And I did sleep on it the other night and it was so comfortable. I'll show you guys right now. Okay guys, this is the pillow that I bought. Everyone's like, did you buy a pregnancy pillow? But it's just a comfy pillow. It's called Yogi Boo. But yeah, it comes in different colors. It's squishy. It feels like, I don't know if it's little styrofoam balls or something in there. I don't know what it is, but it's very squishy. It's very comfy. I slept in it the other day. So comfortable. And I actually had put my legs up on this wedge too. So yeah, I fell asleep like a baby with this concoction here. So I'm probably going to do this after surgery. And it will be easier to get up, I'm sure, with that. Okay guys, I think I have gone over everything I wanted to go over. I'm so glad I wrote it down because there's so much to cover in a video like this, but I did go over everything I wanted to go over. If I forget anything, I'll make a part 2, or I probably will continue to make more videos about this just as I go along in life. But I'm super excited to have my surgery in a couple days. I will see you guys on the flip side, hopefully with better boobs, but anyways, yeah, I'm wishing luck to everyone who's going through this as well. And I hope this video helps you out too. Just know that it's okay to want a better, you know, quality of life and just to be happier and healthier. And so if you know, want to get the procedure done, don't let anybody talk you out of it. It's your choice, you know, just do it if you want to do it. So I'm going to end you guys with that in the beginning part of this video, and then we'll get into the other parts.